So good morning, everybody. I am so happy that you came. We are really thrilled that we got our report done. And so before we start, I just want to say a little bit about the organization and acknowledge some people who are here representing our partner organizations. My name is Marcella Howell. I am the founder and executive director of In Our Own Voice, National Black Women's Reproductive Justice Agenda. Our organization is a national state partnership with 8 Black women's reproductive justice organizations. And I want to introduce some of the representatives who are here from those organizations. A couple of them you will hear from on the stage, but I want to make sure other people who are in the room, folks know who they are. So from Black Women for Wellness, is Lachey in the room? Where are you? There she is. Lachey Brown is representing Black Women for Wellness, which is based in California. Linda Goler-Blount, who is the executive director of Black Women's Health Imperative, is here. Raise your hand again so they know who you are. And there are a number of her staff people who are here as well. I don't know how many. I know I saw, oh, they're all over there. Everybody raise your hand. That's Black Women's Health Imperative. They are based in DC. They're a national organization that works on Black women's health and wellness. New Voices for Reproductive Justice. Lexi White, who you saw at our sign-in table, is here. And Christine Castro, where are you? There you are. Christine Castro. Sister Love, which is based in Georgia, and Sequoia. You know, I can't see a thing from this because of the lights, but Sequoia, so wave your hand, Sequoia. Sister Reach, London, where are you? London has just walked in, and she was also at our intake table. And from Spark Reproductive Justice Now, Heidi Williamson is on their board. She will be actually moderating our panel, but is stuck in the metro at the moment. The AFIA Center, which is Marsha Jones, who's up here at our table. She is the executive director of the AFIA Center. And Women with a Vision, the executive director is Dion Haywood, and she is also sitting up here. And Saquita Borden is also in the room from the Women with a Vision. I also want to acknowledge some of the foundations that have supported us in our work over the last several years. From the Ford Foundation is Brooke Kelly Green. Raise your hand, Brooke. And I should add that the Ford Foundation was our very first funder when we were working with just 5 Black women's reproductive justice organizations. They were the ones who gave us our seed money that really moved toward this. So we are always extremely happy with the Ford Foundation and their ongoing support. And then Ruby Coles from the Mariah Fund, who is another one of our staunch supporters. And actually, when I came and met with her and said, well, we want to do this report on Black women's health and policy and come up with all these recommendations, she says, fine. So I want to thank Ruby from the Mariah Fund. And then the other foundations that have worked with us on this report, and I should add, once we finish here, we're actually taking this report on the road to 10 cities to do policy briefings and Black women's RJ roundtable meetings to really talk with people about how they can use this report and how they can use our 50-state fact sheets that will be on our website next month to really work in their states. And so Irving Harris Foundation was very supportive of that, and the David and Lucille Packard Foundation, and then 2 anonymous foundations that we won't mention other than that they're anonymous. And then I also want to introduce the staff. Michelle Batchelor, who is our deputy director, who's way back there somewhere. And Donna Morris, who's over in the corner in the red dress, or who all of you met outside. So, when we first started writing this report, we were, it was prior to the November election. And of course, we were extremely optimistic about what we thought was going to happen. We had been working with a number of organizations in the collaborative All Above All to to eliminate hide restrictions. We thought we were well on our way to doing that. We had worked on women's health issues, on HIV prevention, and we thought we were really going to have something happen coming up. And then the election happened. And we are now 5 months into an administration that has made it very clear that they are opposed to voting rights, they are opposed to reproductive rights, they are opposed to an educational opportunity, workers' rights, environmental advances, that they literally plan to incarcerate as many people of color as they possibly can, according to what the new Justice Department's guidelines are. So we are now in a new reality, and that new reality is a reality of resistance. The report took a little bit of a scant as we started thinking about that. Most of the report was already written, and then we went back and started to revise some stuff based on our new reality. There are 4 parts to this report. The first one is about writing our own narrative. We met in January of this year to really talk about strategies for the next several years, and one of the things we came up was that it was time for Black women to write their own narrative and to be very, very deliberate about it, intentional about it. And part of that was to examine our current political climate and really talk about what it meant, what we saw, what we thought was going to happen in terms of policy, what we thought we could affect, and what we knew we could not affect, but what kind of things our communities needed to have in place to really fight against the wave of repression and oppression that we saw coming. Our bodies, which is the second part of this report, examines some of those issues that we think are important to Black women and girls and to our reproductive health and well-being. Our lives looks at the intersections of reproductive justice. Most people think of reproductive justice as something that is just about the womb. It is not. It is also, reproductive justice very clearly looks at all of the intersections of our lives, of women of color's lives, and for our report, of Black women's lives. So we also wanted to look at things like criminal justice reform. We wanted to look at some of the issues around housing, around violence against women, and numerous other issues that we thought impacted our lives on a daily basis. And then the last part of the report, our voices, is our agenda for action. Most people call it recommendations. We deliberately did not put in specific legislation. We wanted to make sure that that was open for each state to really look at and think about and come up with what the plan was. Part of the report also involved listening sessions that we did with Black women on the ground. We actually did listening sessions in 6 cities, and the report has write-ups of those listening sessions on what people said, what people were thinking, how people felt about the issues in their states. This report lays out a reproductive justice worldview. Reproductive justice is the human right to control our bodies, our sexuality, our gender, our work, and our reproduction. This right can only be achieved when all women and girls have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, and our communities. Because the reproductive justice framework encompasses bodily integrity and autonomy, our use of Black women in the report includes cis women, femmes, trans, binary, and gender nonconforming people. So it is not exclusive to just women who identify themselves as women because of what the parts they were born with. When it comes to abortion access, Black women in particular have been systematically denied the resources, services, and information we need to make reproductive health decisions. The consequences have been profound. We know that Black women are disproportionately likely to become pregnant unintentionally. They experience pregnancy-related health complications and sometimes become gravely ill or die in childbirth. For many Black women, having the right to abortion does not necessarily translate into being able to access that right. It is one of the reasons why our organization is committed to ending the Hyde restrictions, not just at the national level, but at each state level as well. Between 2009 and 2014, states enacted 300 new abortion restrictions, the majority of which conflict with best medical practices. In the first 3 months of this year, legislators introduced over 1,000 provisions related to reproductive health. 413 of them would restrict abortion services, and 405 are proactive measures seeking to expand access to other sexual and reproductive health care services. The Affordable Care Act, which is under attack right now, but prohibited insurers from singling out women. And of course, under the Affordable Care Act, when it was being debated in Congress, many of us pushed to try and get abortion coverage in there. We were unable to do that, except in the same guidelines as the Hyde restrictions, which is when a woman's health is in danger, or basically it's about women's health and whether or not she could die from childbirth, or if her health was in danger. The Affordable Care Act, however, did require 26 preventive services be included in that, so that women could access those services. And among them were contraceptive coverage without a copay, maternal care, well women visits, STI testing and counseling, domestic violence screening and counseling, and cancer screening without excessive cost sharing. Of course, we know that in the health bill that we now have floating around in the Senate, those provisions are now removed. We also know that because of the health disparities that Black women have in this society, they suffer from chronic conditions that qualify as pre-existing conditions. Again, the Senate will tell you that they cover pre-existing conditions, but what they really mean is, yeah, you can get pre-existing condition coverage, but it will cost you. And it will cost you a lot. And we know that. And so pre-existing conditions can be anywhere from being pregnant, having diabetes, hypertension, obesity, cancer, and STI, including HIV. So people who have these will be excluded from normal coverage. And so healthcare providers, insurance companies, will be able to charge them a higher premium. And that's going to impact on the kind of coverage that Black women get. The House and Senate bills both also, one was, the CBO said one would eliminate 23 million people from the rolls, and the Senate bill now has been scored as eliminating 22 million people from the healthcare rolls. But it also, the Senate bill also impacts Medicaid much more than the House version did. And it is the Senate bill that we think is our real dilemma right now, because it looks like they're going to try to bring that vote up this week. And it does eliminate Medicare coverage. The cuts that they keep saying are the savings are coming from Medicaid. And Medicaid for Black women covers a wide variety of things. We know that, for instance, 49% of births are under Medicaid coverage. So if they eliminate Medicaid coverage and they eliminate having maternal care included, just think what that means. That means that women who are pregnant can't get coverage for their pregnancy. And then once they have a child, they can't get pediatric coverage for their child. And if their child gets sick and they take them to the emergency room, the emergency room care is not covered. This is a bill, when President Obama said it was a mean bill, that's an underestimation. It is really catastrophic. Mean is just a mild term for what it will do. Maternal health, the United States right now fails to meet what are the Millennium Development Goals that the United Nations has put forward to reduce maternal mortality. Maternal mortality for Black women is at an epidemic level. And it cuts across all economic levels, all educational levels. We are not just talking about poor Black women, we are talking about Black women. There are health disparities that endanger Black women when they are pregnant. Now, there are also police violence, which endangers Black women when they are pregnant, but I'll get to that a little bit later. But maternal health pieces that endanger, we are literally on par with Afghanistan and El Salvador in terms of maternal mortality, and that's outrageous. Up to 4 times more likely, Black women are up to 4 times more likely to die of maternity-related causes, twice as likely to experience severe maternal morbidity, and 40.4 deaths per 100,000 live births for Black women. And that is compared to 12 deaths per 100,000 live births for white women. That is a vast comparison that we need to be able to come up with how we fix that. And when you look at what the Trump administration is doing, the Trump administration is making it clear that they have no intention of fixing that. As I said, regardless of educational levels, Black women are less likely to receive timely and consistent prenatal care, are more likely to experience a pregnancy-related injury or death, and compared to women of other races and ethnicities. And when we think about it, the complex web of what causes these, there have been some preliminary studies that look at stress factors in terms of impacting Black women that may lead to some foreshadowing of exactly what causes this. But there's not enough research being done on it. There are some states that are starting to do research, but there really is not enough research that is being done, and that's one of the things that we would push for, is much better research being done. But also, to make sure that more doctors are Black, more OBGYNs are Black, that understand that when they walk into an emergency room or they walk into, their patient walks into their doctor's office, they are not automatically making assumptions about a Black pregnant woman when that person walks in the door. And we know that only 6% of physicians are Black, only 4% of OBGYNs are Black, and fewer than 4% of certified nurse midwives are Black. We need to change those numbers as well, because having culturally competent medical professionals is a key as well. We know, and I want to move on to contraceptive equity. United States has a very troubling sort of relationship with Black women and contraceptives. We know that a lot of birth control pills and other kinds of contraceptives were tested on Black women without their consent. We know that sterilization without consent was a practice not just by a few doctors, but by state agencies. And we also know that a number of women are coerced into using certain types of birth control that they don't really want. And that's coercion is also become very prominent now that we are looking at long-acting reversible contraceptives. That one of the things that we did, one of the listening sessions that we did, we asked women to talk about their experience in trying to get birth control of different kind. And we found that a lot of them said that they actually went in asking for one type of birth control and were talked into getting something else. Or they walked in and they were told that they needed to have a long acting reversible contraceptives, but sometimes not being told how the reversible part was supposed to happen. And so they were basically given things that they did not want. And we saw that in the past with Norplant, where people who were receiving public assistance were told they had to have Norplant implanted if they wanted to continue to get public assistance. And then when they wanted to have Norplant removed, they were told there were no funds to remove them. And that was mostly in Black and brown communities. And so we see the same type of thing happening. We are working with the Guttmacher Institute to do some on-the-ground research on provider bias around LARCs. And we're hoping that that project will be extended and really start to work and look and go and talk to women. Guttmacher has traditionally interviewed the provider. We are now pushing them, along with Latina Institute and NAPOF. I'm looking for NAPOF, I don't see them. There they are. To actually start interviewing the women who actually come into healthcare clinics or come into their doctor's office and see how they feel about the provider bias and what kind of contraception they get. We also want to talk a little bit about the high cost of contraception. If they were to remove the cost coverage in the Affordable Care Act, we know that at one point there was a time period when Congress basically through a glitch did not include coverage on college campuses for contraceptive in these healthcare clinics, and the cost of contraception skyrocketed so that young women were not getting contraception because it cost too much. And that glitch was fixed, and then the Affordable Care Act, of course, added contraceptive coverage, which has constantly been challenged in the court. But these bills that are coming out now, the repeal bills, do not include that at all. So we expect that if indeed they pass and are signed into law, that young women will be in that same position of not being able to get contraceptive coverage. And in fact, in one of our listening sessions, one of the participants actually said, my experience is that we're not given all the options that other people are given. I've heard some really ugly stories, and it's scary. This particular young woman went in to get contraception and walked out with an IUD, which she didn't want, but that's what she was given. And so when it comes to contraceptive equity, Black women need to be able to have bodily autonomy and be able to make the decision with full information about what the side effects of every kind of contraceptive is, and then make their own decision based on their needs. And that's not what's happening these days. And before I close, I want to talk a little bit about the intersections that I mentioned. We recently watched, just last week, was it a week ago? Charlene Lyles, who called the police because she believed that her apartment had been broken into. The police arrived, and in a very short time period, which we have no knowledge of what actually happened in that apartment, she went from somebody in distress and needing the help of the police to being dead. And the police said that she threatened them. This was a woman who was 5 months pregnant, who had her children in her house, and the police, basically 2 police officers walked in and they killed her. And so when you hear the term protect and serve, that doesn't exist for Black women. It doesn't exist for Black communities. This woman literally thought that she needed help from the police, and she is now dead. And we have seen before that we know that nothing's going to happen. The police won't be charged, and if they are charged, they will be acquitted, and nothing really will happen. And that's part of the reality of being Black in this country. And if it's not your own safety, then you wake up every day and you have to worry about the safety of your children. You worry about them walking out in the street and a police officer deciding that your son is too big and therefore a threat. Your husband is too big and therefore a threat. Your daughter is a threat because she's black. And that's the kind of thing that needs to stop as well. But we have a Justice Department who is now pulling out of all the consent decrees that have been put in place during the Obama administration. This Justice Department under Jeff Sessions is now eliminating those, no longer wants to investigate law enforcement entities because they think that being pro-police means you have to be against anybody who comes into the view of a police officer. Instead of seeing that they run parallel, you should be protecting citizens as well as protecting law enforcement. And this administration doesn't think it's necessary to do that. So police violence is a reproductive justice issue. It demands that we have the resources and ability to raise our family in dignity, and that means black women should not be afraid every time their children walk out the door. It means they should not be afraid if they call the police for help. It means that they should not be afraid if they are in a car driving down the street and are stopped at a traffic stop. All of those things factor into what is part of the life experience that we now face, and that will probably get worse. We also know that one of the other pieces are economic justice. And it's very fascinating because on one hand you have a political party that seems to not care about us when it comes to police intervention. And we have now another party that doesn't seem to care about us when it comes to economic equality. And they talk about economic equality as a way of trying to coerce white male voters into the party. And they compare it to economic equality versus identity politics. And I always think it's fascinating when a white male talks about identity politics in America. Because if they are the experts on identity politics. And so a vision of economic equality that does not include racial and gender equality is not progress, it's Jim Crow. And we have been faced with that in the past, and we will face it again with all of our resilience that we need. But when we look at economic equality, we have to understand when people talk about what women make in comparison to white men, we really should start with what women of color make in comparison to white men. Black women make 64 cents to every dollar a white man makes. And that means if a black woman starts working full-time year-round at the age of 20, over a 40-year career, she actually will lose $840,000 in comparison to what a white man will make. Think about that, $840,000 in your career. And so part of what we need to be talking about when we talk about economic equality is looking at it through a race and gender lens. Because black women are penalized both as women and as black people when it comes to economic equality. One of the other intersections that we wanted to talk about is how we bring faith into our work. What's fascinating to me, when I talk to a lot of people, they always say, well, black women don't really want to support these issues. They're a little nervous around abortion and contraception because we know that your communities are very, very religious. Well, what we also know is that black women are probably the most progressive voters in this country. And that when we polled them, we asked a question about how they felt about certain issues around abortion rights, around contraceptives, and how that would relate if their minister was telling them something different. And we found out, like all of us who are Black know, that Black women are extremely independent. And what they said was, minister over there, my life over here. I go to church, but the minister does not get to tell me how I feel about my body and what I do with my body. And that's something that we need to get out. We need to stop assuming that because our communities are very religious, that somehow that means we are conservative on these issues. We are not. We are very progressive on these issues. And we do have, as I mentioned, Sister Reach. Sister Reach actually is one of our partner organizations and works specifically from a faith-based perspective. And a number of our organizations work with Black churches and the women in those churches to really further our goals in making sure that we understand the differences between our church-going days on Sundays, and some on Saturdays, and some during the week, but church-going throughout the week. When we asked that question, we actually asked people who self-identified as very religious, which meant that they went to church more than once a week. And they said no. In the high 80s, we support abortion rights. In the high 80s, we think it should be funded. We support contraceptive access. We think that should be covered under insurance. We support teaching comprehensive sex education, and we think that it should include gender identity and sexual orientation in that teaching. So we are very progressive on these issues, and even though people think something else, they're wrong. So I'm going to stop here, and what I want to do now is introduce, oh, there's Heidi. Heidi Williamson is one of the authors of our report. She is also the founder of a consulting firm. She worked with us as a consulting firm. As I said, she's also on the board of directors of Spark Reproductive Justice now. And some of you know her in her capacity working for CAP. So I'm going to introduce Heidi, and Heidi is going to introduce our panelists, and they are going to talk about their perspectives from the organizations that they work within. Heidi?
Good morning. So excited to be here. This report has been a long time in the making. So I have 3 phenomenal panelists to introduce you to, and you're going to absolutely love each of them as they talk about their different perspectives on reproductive justice and Black women. First, we have Deon Haywood, Executive Director of Women with a Vision. For more than 25 years, Deon has worked as a human rights defender and advocate for poor women, Black women, and queer women in the Deep South. Since Hurricane Katrina, she has led Women with a Vision to a vibrant and locally rooted international network addressing the complex intersections of socioeconomic injustices and health disparities. In 2009, Deon oversaw the launch of Women with a Vision's No Justice Project, a campaign to combat the sentencing of women and trans people arrested for street-based sex work under Louisiana's 203-year-old Crimes Against Nature felony law, which resulted in a federal judicial ruling and the removal of more than 700 women from the sex offender registry. That was amazing. Deon has received numerous awards for all of her leadership at the intersection of HIV/AIDS, harm reduction, LGBTQ rights, reproductive justice, and criminalization. She was honored in 2011 with the Political Activism Award from Forum for Equality. She was awarded in 2010 the Community Spotlight from thebody.com, BET's 2012 Health Hero Award, and the representative from the U.S. South to the 2013 Frontline Defenders Dublin platform. She's also testified in front of the United Nations Global Commission on HIV and the Law in 2011, and currently she sits on the board of Breakout, a youth-led organization fighting the criminalization of LGBT youth in New Orleans. Deon is a native of New Orleans, Louisiana. Let's welcome Deon. Next, we have Marcia Jones. Ms. Jones is the Executive Director of the AFIA Center. She is a Dallas, Texas native and is co-founder of the AFIA Center. She holds a bachelor's degree in psychology and is a graduate of the Black AIDS Institute's African American HIV University and Tyndale Theology School. Marcia serves on the board of directors for the Texas Equal Access Fund and is a member of the following national initiatives, which focus on women and charged with the advancement of gender and race equity and the elimination of healthcare disparities. 30 for 30, Texas Black Women Initiative Dallas Team, U.S. Women Working Group on PrEP, National Women AIDS Coalition, and Rockwood Fellowship for Race and Gender Justice in the HIV/AIDS movement. Marcia is a national grassroots organizer, community mobilizer, professional speaker, group facilitator, and health educator. Marcia's life commitment is to transform women and girls' lives. She is pledged to the development of leadership and the engagement of activism among women by challenging harmful systemic political constructs while continuing to advance the economic health and safety of women and girls. Let's welcome Marcia. Finally, we have Masanya Traylor. Masanya is a mother, speaker, and community activist. As a nurturing mother of two beautiful children, Masanya passionately dedicates herself as a global activist for HIV/AIDS through her nonprofit organization, Lady Burgundy. She was born in Allentown, Pennsylvania in 1987 and moved to Atlanta in 1991, where she was raised in Decatur, Georgia. Woo woo, Decatur. During a routine medical visit in late 2010, she was told by her provider that she was not at risk for HIV. At the tender age of 23, though, she was diagnosed with HIV. She was diagnosed as HIV positive, and 2 weeks later, she found out she was pregnant. This completely changed her life. Ms. Traylor is a pharmacy technician and a distinguished alumni of the Andrew Young School of Public Policy Studies at Georgia State University, where her concentration was public policy and nonprofit leadership. In addition, she has served as the youth representative for numerous AIDS servicing organizations and groups such as the Georgia Community HIV Prevention Planning Group, the Red Pumps Project, and Absolute Care, just to name a few. She takes pride in currently serving as the ambassador for the Kaiser Family Foundation's Greater Than AIDS Empowerment and We Are Family program and the CDC's Act Against AIDS, Stop HIV Together campaigns. She's made many appearances on a number of radio shows as well. She has reached over 60,000 young people, empowering and educating them on HIV, and aspires to reach another 60,000 during the 2016 and 2017 school year. Let's welcome Masanya. So Dion, we're gonna start with you, and we want you to talk to us a little bit about what it's like to work with formerly incarcerated women and to intervene in the criminal justice system in such an enormous way, as your bio stated.
Good morning, everyone. I first want to say it's so nice to be here. It's so nice. This is my first time speaking since I'm returning after a bout with breast cancer. So this is, my first time speaking. I hope I don't have chemo brain when I'm going through this. So our journey to criminal justice reform and ending mass incarceration actually started in our work in HIV prevention and harm reduction. And I wanted to say that because the many ways that women and queer people are targeted is a lot of times through our healthcare systems. And a lot of times people don't always recognize that, right? And so one of the things we started doing is looking at how women we were working with and doing HIV prevention work, doing harm reduction, was how often they were being arrested, how often they were coming in contact with police, and how often they were like just cycling in and out. And when I say cycling, I'm talking about 3-month intervals in what we have in New Orleans is the parish prison. And so we started looking at how laws like the Crime Against Nature law, which was if you are caught having anal or oral sex, actually put women at risk for HIV. That law that had people thinking, well, you can't carry condoms. If you have more than a certain amount of condoms, then okay, yeah, you're probably selling sex, right? And we understood back then that, well, this wasn't the answer. And so we started just placing ourselves in situations that was really hard, like placing ourselves at the table of the criminal justice system. We, after Hurricane Katrina, there was a committee put together by the American Bar Association that looked at harmful laws and policies and how it was affecting people. And so we joined that committee, and from there, it branched out to looking at bail reform, which many of you, I'm sure, have heard about in your areas, looking at bail reform, looking at how women really weren't even seen as a part of ending mass incarceration conversations or criminal justice reform. How most women in jail don't have access, who are incarcerated, those on the inside don't have access to reproductive health care. They don't have access to birth control when coming out. So we just started spending time in the criminal justice system as well as in the local jail, the state-run prisons. We just started spending time and talking to women about what their needs are. And where we are now, I would say we've made a lot of progress in terms of working with the New Orleans Police Department. We've actually worked with them for them to it never lasts, but for them to stop targeting women who are involved with street-based sex work. We are working with the MacArthur Foundation as well as Vera Institute, all in ways to reform bail. What are other options when a lot of times what women in our community need is care and access to services, not prison. And so those are a lot of the tables we've been sitting at as of now. We also have, one of the things we looked at when we went into the jail is we asked over 200 women who were in the jail, what did they need? All of them asked for a parent. They wanted to learn how to be a better parent, literally. And most people are shocked when we say that, but they're mothers. Many of the women who are incarcerated are mothers. And they were like, when I come out, I want to be prepared so I can get my kids back. When I come out, I want to be prepared to have a place to stay. And so we started working with local providers to look at how can we work with Unity for the Homeless to provide housing. How we actually set up all the care. We got Boys and Girls Club to come in and do parenting classes at the jail. But what happens to people, and those of us who go on the inside, is eventually they throw you out. So they threw us out the jail, and so we no longer have access because we were making too many waves. So they threw us out, but it didn't stop us. We just started joining the national tables and really looking at how we were going to reform. We actually did have a consent decree in New Orleans. We're not sure whether it's going to go now, because, yeah. But one of the things we really have tried to do is provide access to services that women who are coming out need, where we do sit at the table, but the biggest changes for us is how do we change the way women see themselves? How do they see themselves moving forward and having access to the things they need to be well? And that's kind of like, yeah, where we are.
Thank you. Thank you so much. Marcia, can you tell us about some of your collaborative work around abortion access in Texas?
Yes, so it's interesting. So again, like you, Dan, I'm really excited to be here. Yeah, it's a little overwhelming too. But so this is the thing. Usually I go somewhere and I talk, right? And I never write anything down. I say, I don't write stuff because I'm just gonna let the universe control what I say. So I wrote like all this stuff to make sure, because I promised the people in my office that I'll do better. So, yeah, what you asked me is not on here. So, I cannot wait to get home and tell this. So the collaborative work that we do in Texas around abortion work, so we came into this work really not like just like running first head on with abortion work, right? Or anything like that. Not even around a work around feminism or all of that stuff, because prior to doing this work, I never thought, I didn't know that I was a feminist. I didn't know, like, I didn't see that in me. I just saw that things were not right. And so I didn't have like this foundation of feminism in front of me that I thought to kind of build on to address these issues with women in Dallas, actually. But then I realized after doing this work that like feminism and all that just flowed through my veins. It was just there. It's inherent in us as black women. So we really started this work doing HIV work. I'm old enough to have, I know what happened in the community of HIV in the very beginning. So I have a whole community of friends who are dead. And so I made a lot of deathbed promises. You know, I said, I'm gonna be there, I'm gonna do something. Nobody else is gonna have to die the way you die, with shame and stigma, and it's not gonna happen. And so life happens, and I had to raise my children, and I came back into this work and into this world in about 2001. And I only came to I wanted to educate the whole black community, because all we needed to do was be educated about HIV, because if we had the education, we would no longer get infected. That's what I thought. That's what this church girl thought, if we just educated people. But when I walked into the space, I realized that that was not it at all. And that black women, nobody were talking about black women. Everybody was being talked about but black women. And so I literally left corporate America. My daughter was going to college, took my 401k plan, left corporate America because I needed to know what was going on. Why was black women getting infected with HIV? And I realized that it had absolutely nothing to do with our behavior. It had everything to do with the situation and the circumstances that we found ourselves living in. And those are the things that dictated how and when and who we had sex with, and not necessarily what the outcomes of that sex was going to be. And so we literally started from the ground up, talking to people, like literally going out on the street, sitting on the curb, talking to black women, asking them, what do you want? What do you need? How do we fix this? And so just out of 7 or 8 years of being on the grind and being on the ground, scratching and scraping and doing this work and positioning myself in spaces where I was not even invited, I just came. You know, if you were talking about black women and nobody sitting at the table was black, I needed to be there. And saying that, like literally, that's what I would say, and questioning people who were doing this work, and being in spaces with women like you all, and really understanding what reproductive justice is and how that all worked out. And if we were not using that particular framework, we were never going to get to the bottom of this problem or what was happening in black women's life. That's just the way it happened. And so we started to, I'm not going to necessarily say people invited us to come. We created relationships where there were no relationships there, and we did the work and the study and became the experts on what was happening in our city, in our state, to these women. And then we were bold enough to point it out. Because one of the things that I know, I would say, even when I would go to the Ryan White meeting and I would say stuff, and I would say, there's nothing I have to lose here. I'm not funded anyway. So what? Were you going to take my funding? I don't have any. And so that's what we would do, and we did this. And so then we decided to do our work unapologetically black. I know that, because I said this, I said, if Phil Wilson can get up and talk about HIV, about black people, for black people, and black people are going to be able to fix it, and he is a black man, and he can say that, and he's getting funding out of the caboose, then I can say it as a black woman. So I'm going to say that we're going to do this work unapologetically black. Not that we had anything, we have no issues with women of color. We can all organize as women of color, but in the midst of all this, I still need to be black. And black women needed to know that there were black women talking. So when we rolled around, so in doing the HIV work, we realized very quickly that you cannot talk about HIV if you're not talking about women's reproductive rights and health and all of those things and economics and all that stuff that go to it. And so I realized that the very same thing that bring a woman to my HIV clinic, a black woman, it's the same thing that bring her to the abortion clinic. It's sex without a preventative measure in place that leads to an unintended outcome, be it pregnancy or HIV. and we still send them back to the same situation. So even if she wasn't pregnant at that time, or even if she didn't get HIV that time, if you keep sending them back to the same situation, and it's inevitable, they're going to either become unintended pregnant or unintended HIV, because nobody, and very few people tend to, I didn't intend to get pregnant. I won 3 times I got pregnant. And I definitely would not have, that would not have been my intentions to become infected with HIV, had the right preventive measures, the conversations, all of the things that's in this book, that's in this report, had those things been there, would have prevented a lot of stuff. So anyway, our role into it was complicated, but we are there. And so we share partnerships with people in Texas. We work with a group of folk. We find ourselves being the only Black folk in the space quite a bit in Texas. Even in our work around abortion work, we decided that not only would we do abortion work, but we found it very necessary to talk about the fact that in Texas, Black women were dying wanting to have a baby. So we felt like it's just as important to make sure that Black women have equal access to all of the things they need in order to make informed choices about having an abortion, but they also need to have the measures put in place that if I decide to have a baby, I'm not supposed to die. I'm supposed to see that baby live its expected life term. I'm supposed to live, and my children are supposed to live. And so that's more of the fight that we're fighting right now. We are in the abortion fight. We're in it 100%, because if folk in Texas are going to be talking about if they're going to be talking about Black women having abortions, we're going to be talking about it. We get to tell our own story. We don't need for you to continue to tell our story. We can tell it better than you can. But also, Black women, somebody needs to say, Black women have the right to live. And so that's what we're doing. I'm going to be leaving here. Part of the reason I'm leaving here early is that we're preparing for this special session that our governor so graciously decided to add maternal mortality to special session when you knocked it down 3 times in the session.
Thank you so much. Masanya, please tell us a bit about your story and what it's like accessing healthcare as an HIV-positive woman.
Thank you so much for having me here, Marcella. It is such an honor to be amongst these 2 women, and I am overwhelmed, especially by the work that they do and understanding how what they do inadvertently impacts me in Atlanta, Georgia. Growing up in the South, although I was born in Allentown, I know nothing about Allentown. Don't ask me how to get there. I know nothing other than I was born there. However, growing up in Decatur, I realized that, I definitely had a mother. I was raised by a single parent, by my mother, and my father has been incarcerated my 30 years of living. That's all that I know. He is soon to be getting out. And listening to you, I'm realizing my mindset of what I'm going to have to deal with when my father does come out. The expectation of supporting him. Although I am living with HIV and a single mother of 2, one of which father has a mental illness of schizophrenia. And knowing that I have these different situations that I have to acknowledge, I still have my own life to take care of, and it's not solely my HIV diagnosis. There's a catch-22 to this. So I was diagnosed at 23. It'll be 7 years in October. I'm 30 now. So of course my mindset is a lot different. I'm a whole lot more mature than I was when I was initially diagnosed. I was very traumatized when I found out. I had not thought that my diagnosis would come back as a positive result. I had always expected it to come back negative, and it was just something that I was doing to encourage, advocate for my friends to do the same. Because I knew that although I did not judge their risk behaviors, I understood that they had engaged in behaviors that were a whole lot more riskier than I was taking. So although I was in a monogamous relationship at the time when I was diagnosed for about 4 years, I also started realizing that once I got diagnosed, what brought me to this point? Was it because I was raised by a single parent? Was it because I didn't have enough education? Was it because I just did not know that there was a high prevalence rate of HIV in my community where I graduated high school, got my first job, started college? What was it? And as I began to dig deeper and deeper, I began to fall under not only how the AFIA Center started, but what they're doing now. I have since had an abortion, but I was not aware that access to abortion rights was something that I would have to be sitting up here also advocating and fighting for today. Access to health care. When I was diagnosed, I was under my mother's insurance. I did not know a lot about health insurance, but I did understand that I was under my mother's insurance. I was working in the pharmacy, so I was dispensing HIV medications. However, I was not aware of how those HIV medications were keeping people alive, and oftentimes I did not see women coming to pick up their medications because of the area that I was working in. When I started working at a different location, I was right next door to a housing facility for women specifically living with HIV when I was diagnosed. I did not know that until I got diagnosed. I was very unaware of Medicaid and how to access it, and I was very unaware of food stamps, welfare, any of that. All I knew was to get up, find a job, go to work, go to school. So I had been working 3 jobs while in school on public transportation. Once I had my daughter, who was born HIV negative in 2011, I had a decision because I got dropped from my mother's health insurance at 23, because if you were 23 and older at the time, in 2010, you would get dropped from your parents' insurance, right? And when Obama came into office, he extended it to age 26. So I fell in that loophole. At the time, I wasn't really concerned about my health. I had no symptoms or anything like that. I just usually would do it a part of my annual routine test, and no one had encouraged me to get tested annually. It was just something I decided to do because I understood that HIV could possibly lie dormant in your body for up to 10 years. And since I had my son at 16, I still wanted to continue getting tested annually. It was just something that I knew that was important for me to do whenever I got my pap smear. Once I was not able to transition on my mother's health insurance and I was unaware of COBRA, I was able to apply for Medicaid only because I needed childcare. And I found out that if you were not working, you could qualify for everything. Food stamps, Medicaid, and childcare, and all I needed was childcare because I had a job, and I needed someone to watch the child while I had a job. That was it, just a couple of hours once he got out of school, for 3 hours. Now, once I cut my hours back and I quit the job, I qualified for everything. And once I got the job and I got the child care, I didn't need the food stamps or the Medicaid at the time, but I had it. So once I got the Medicaid, I got tested immediately. And once I got diagnosed, I had to make a decision between trying to get my mother's health insurance back at 23, which was a little over $400 a month, or go back to school to get my bachelor's degree in college. I could not afford both. I had to choose. Once I found out that I was diagnosed with HIV, my mother said, well, we'll just pay for your health insurance because I've been paying for it all this time anyway. I can afford $600 a month as opposed to $400. I can do that for you. I told her, no, I don't know how I'm going to do it. I'll work it out. Made $400 a month or more, I cannot get Medicaid. I would no longer qualify for a household of 3. I am still stuck in that situation this day. Excuse me. Today, I'm still in a catch-22 situation where if I make over $400 a month, I no longer qualify for Medicaid. This year alone, I had caught the flu. I went 1.5 years without HIV medication because I made too much money to qualify for Medicaid. However, when I applied for health insurance, my out-of-pocket expense for my $3,000 medication was $900 a month, which was equivalent to what I made monthly. That instilled an extremely high level of fear. So I went to the health department. The process there was very strenuous, very stressful. So the only thing that I knew to do at the time was to focus on my mental health and my lab results. I knew that I was very educated about my viral load and my T-cell count. So that's all I focused on. I went every 3 months to get my labs done, and I focused on my mental health. So I was going to see a therapist every 2 weeks. Starting with a new therapist was extremely hard, but I also did not receive any medications for mental health therapy. I just knew to focus on, if I would focus on exercising and what I ate and anything that I could be grateful for, I would do that. That would help with my mental health. I requested from my pharmacy that I was working at, if they would give me full-time hours and benefits, I would commit to them full-time. I need the benefits. I did not disclose my HIV status to my new pharmacist that was in our new pharmacy manager that I had. She would not give me that position, although it was available. I had been there for 6 years. I told them I could not work nights and weekends because I had children. And not a lot of support around watching them. Once I had the flu, and this pharmacist was unaware that I was HIV positive. Mind you, I have to say this part, I had recently been featured in Time magazine. She's very unaware.
Unaware. Okay.
She was not black either.
Unaware.
She told me that if I could not complete some computer work by Monday, it was Friday, that I would be terminated as a PRN part-time worker, filling in for other people because I'm scared to make over $400 a month. I told her, please accept this text message as my letter of resignation. And I prayed and said, I will find a way. So when I look at Medicaid expansion and what it could possibly do for me, when I look at having access to not only abortion rights, if I wanted to have an abortion, when I look at $3,000 medication that I feel like if I knew the prevalence rate of HIV in my community, if I understood what it meant to make healthier reproductive decisions for my lifestyle, then maybe I wouldn't be HIV positive today. I have no regrets. I am not ashamed of my diagnosis. I feel healthy, I feel good, and I feel proud to be sitting amongst you all today, yet still my life is threatened by the policies that are rolling out. They make me angry, they make me frustrated, and sometimes fearful. But I know that there are other women across the nation that are experiencing a lot harder, just more hardships overall around their HIV diagnosis and having access to health care. And that process of accessing health care is what shuts people down from even seeking it. So as a woman living with HIV, access to health care for myself at the age of 30 is still extremely difficult, even with an associate's and a bachelor's degree. When I look at the pay scale and when I'm applying for these things, I still barely have enough money. Once I budget just food and housing, I barely have enough money for the basic necessities to afford to still live. It is still a daily struggle. So, as a woman living with HIV today, access to health care, it is not one that is just a simple process and something that's, oh, these poor people are just taking everything and they want nothing more than to live for free and not contribute back to society. We want more. Thank you.
Thank you so much. I know you may have questions for our phenomenal speakers, but before we actually take Q&A, I'm going to bring Marcella back up so she can tie all of this together with many of the recommendations that are in our report. So here you go, Marcella.
So, part of what we wanted to do today was to make sure that people actually heard some of the lived experiences that Black women face every single day. We live in this bubble called DC, and there's a real world out there. So I wanted to wrap this up by just walking very quickly through our agenda for action. These are our recommendations. As I said, they're not policy specific, that is saying this department should do this department should do that. What they are a template, an agenda for action to work within our different states. They are designed primarily for our organizations and like-minded organizations to really start to work within their states, but they're also an agenda for actions about Black women taking lead in our own lives. One of the things that we talk about is we know that last November, 94% of Black women voted for Hillary Clinton. We knew Mr. Trump was not somebody who was going to look out for our best interest, and we made sure that our votes said that. One of the things that we believe we need to be doing more of is reaching out to Black women voters and engaging them in this process, engaging them in how looking at policies and how those policies actually impact their everyday life. Now, what's interesting is this current Congress and this current administration is going a long way to helping us do that. It's so very evident these days, but as I said, out in states, this has been happening in states for a long, long time. And the fact that we now have it happening so much at a national level gives us an impetus and a way of reaching these people. So one of the things we're talking about doing is to really pay attention to voter engagement and getting out the vote in each and every elections as we go along. We also want to talk about making sure that Black women are running for office, because the people who we know are going to look out for our best interests are us. And so making sure, I don't know how many of you watch Senator Kamala Harris on TV during all these hearings, but I'm telling you, the sister was fierce. And having lived in California for a long, long time, and having one of our organizations, Black Women for Wellness from California, that was a delight. And I rarely give candidates money, but I did give her money to run for the Senate. And I am just so proud I can barely contain myself, but she was fierce in all these things. And I thought it was fairly interesting that so many people started writing about the fact that John McCain kept interrupting her and interrupting no one else, and that was an attempt to shut down. And what is happening now? We're talking about obstruction of justice, which is what she raised throughout both of those hearings. We also need to start financing our own Black women candidates. One of the things that we know happens a lot is a lot of these women's PACs look at Black women running for office and they think they're in safe seats, or there's so many people running in the primary that they don't get behind the Black woman candidate who's running. We need to do that for ourselves. It's time for us not only to run for office, to find people to run for office, but also to finance those people who are running for office. It's also time for us to do the kind of trainings around activism and advocacy that we need to do to make sure that people understand what's going on. And above all, as you heard on this panel, we need to tell our own stories. We need to talk about our own lived experiences. So that's what our report is about. It's about looking at those issues, it's about telling our own stories, and it's about organizing in Black communities across this country to make sure that Black women are looking out for Black women, and where there is an avenue to pair with other women of color, we will do it. Where there is an avenue to pair with ally organizations, we will do it. But Black women will lead in Black communities, and we will raise our own voices to talk about our own issues and talk for ourselves and tell our own stories. So I want to thank everybody for coming.